we have investigated brain health outcomes in sexual and gender minority groups. And maybe first, what is a sexual gender minority group? It's also known as LGBT plus community. It's a group that has been historically underrepresented in medical research, and they are defined by their sexual orientation and gender identity. So sexual orientations are, for example, gay, lesbian, bisexual, and other sexual orientations, and a gender identity would be, for example, transgender or gender diverse, which includes also, for example, gender queer and other identities. And this group has not really received much attention in medical research so far, but we know from the research that is out there that they do have increased risk of different diseases, of also, among other things, a twofold increased risk in mortality compared to non-minority persons. But the literature is not really comprehensive when it comes to neurological diseases, because I think the awareness in neurological research for the specific group hasn't been there until maybe the recent years. So we just wanted to fill these research gaps with the help also again of the All of Us research program. The All of Us research program is a large US cohort enrolling up to 1 million Americans. Currently, we have data available of about 400,000 participants so far. And one of the most interesting aspects of this study is that they have defined diversity as one of its core values. So they are enrolling or they're purposely oversampling participants from minorities groups that have been historically underrepresented in research, such as race, ethnicity, based on also disability status and so on, but also based on sexual orientation and gender identity. So it's a large cohort, maybe one of the few that I know of that has this information available. And we were assessing participants based on their self-identified sexual orientation and gender identity. And we looked at brain health outcomes, specifically first at the composite brain health outcome, which encompasses stroke, dementia, and late life depression. And for those three specific outcomes also, we looked at them separately. To summarize, we could find that all sexual gender minority groups were at increased risk for brain health outcomes or for adverse brain health. And this applied to several subgroups as well, with specific risks for trans women in stroke, and for persons assigned female at birth in dementia, and for persons assigned male at birth in a late life depression. What we hope to show with this project is that the healthcare disparities for this specific group of sexual gender minority persons are very underexplored, and there are definitely increased risks for neurological diseases. The specific factors that cause these healthcare disparities are unknown to date, but we hope to inspire more research within this field, and also to maybe attract attention of medical research, but also maybe healthcare practices in the future to this specific community.